Hey, it's Brian Thomas from the 55 KRC Morning Show with my friend Dr. Randall Wolf of the Atrial Fibrillation Center of Cincinnati. We'll give you the information on the AFib Center, but we talked this morning on the Ask the Expert with Dr. Wolf about atrial fibrillation, the heart condition. But there's a component to AFib and a part of the procedure you do that we really didn't dive in a whole lot, but you did mention it, the left atrial appendage.
Correct.
Tell me what that is, what it does, and why you take it off.
It's a little ear on the heart, and it's important in the development of the heart before we're born. But after we're born, that little ear doesn't do anything. It's just a cul-de-sac. That's where the blood clots when the heart's in AFib. That's why people take a blood thinner. It's just for that little spot, it's a little cul-de-sac. And we figured out 12 years ago, if we removed that, then they wouldn't have to take the blood thinner anymore. Even if we didn't cure the AFib, even if the heart was still in AFib, they would not have to take the blood thinner anymore. And now we've removed over 1,000 appendages, over 1,000 patients, no strokes after the surgery, zero.
That's amazing.
Yeah.
A useless piece of your heart is really the problem, and why you have to take a blood thinner every day of your life.
It's sort of like the appendix.
That's phenomenal.
It's similar to the appendix.
But while you're in there doing this, you address the atrial fibrillation with a different part of the procedure, but you always remove that, always avoiding the stroke. But your success rate with getting rid of the AFib on top of it's like 90% anyway.
Yeah, we're 80 to 90%, which is twice as good as any catheter ablation procedure right now. That study was just done in Europe using my technique. I go to the University of Barcelona every year for a week as visiting professor. They did a study. Half the patients got the catheter, half got the surgery. A year later, the cure rate was twice as good with the surgery as it was with the catheter.
Hey, it's a no-brainer. Get in touch with Dr. Wolf, the Atrial Fibrillation Center of Cincinnati. Wolf, W-O-L-F, Mini, M-I-N-I-M-A-Z-E, wolfminimaze.com. And what's your office number again?
We have 800, no, well, it's 877-900-AFib.
AFib, A-F-I-B, makes sense. Dr. Wolf, good talking to you. Take care.
Brian.